All right. Hello, everyone. My name is Evan Beale. I'm a physician assistant over at West Dermatology. I'm based in San Diego. I also practice in Yuma, Arizona. Thank you for joining me today. I'm super excited to talk to you guys, and I'm joined by my esteemed colleague and mentor as well, Dr. Brook Brouha, and he'll be, speaking at the second part of this presentation, and I'll let him go ahead and introduce himself now as well.
Hello there. I'm Dr. Brook Brouha, and I'm here today to speak with you after Evan, and I'll enjoy chatting with you.
All right, so I'm going to basically start this presentation by just giving some introduction and background information regarding skin checks and melanoma. I thought that I should kind of focus this, the beginning part of this information just to give some basic information and answer some common questions that I get from patients. Next, so the first question I get asked very often is, how often do you recommend getting your skin checked? So I recommend that you should see a skin doctor for a full body skin examination at least once a year if you're just a regular adult with, no other issues and no other history of skin cancer. If you're at a high risk of skin cancer, you definitely want to get some more frequent skin checks. This can vary. It really depends. This could be every 3 months or 6 months, and it just depends on what type of history of skin cancer you've had, such as a basal cell, squamous cell, or a melanoma, and if you've had any personal or family history of skin cancer, or if you just have fair skin and live in a sunny area. This is usually decided by your dermatologist, and they'll put you on a correct monthly or 3 or 6 month program. Early detection of melanoma gives you a 99% likelihood of being cured. So I think that this is really important because it means if you monitor your skin regularly, that means you're more likely to find skin cancers at the early stage when they can be treated successfully. Allowing a melanoma to grow unnoticed reduces your chances of survival to just 50%. So it's super important to get them early and get them fast. And the only way to do this is to be good about your skin checks. Most skin cancers grow silently without symptoms. This just emphasizes my point earlier that skin checks are super vital. This makes me think of the patients I've had are usually men because men will just let things go unless it really bothers them, if it itches or hurts, and as I said, they're without symptoms, so they'll just let say a big melanoma on their back grow to a stage where it could spread to their lymph nodes or other organs just because it doesn't bother them. And just because the fact that it could be there and not present anything that alarms you is just a more of a reason why you should be good about going in for those yearly skin checks. I recommend that all adults check their own skin every month. Other dermatologists will say every 3 months, but I think it's not unreasonable to do every month. And it's important to completely examine your skin from the top of your scalp to the soles of your feet. Generally, it's hard to see behind your ears or your back, so it's definitely useful to have a partner or friend who can do that for you. 60% of skin cancers aren't first noticed by a doctor, but by the patient or spouse. So this kind of goes to the old saying of wives save lives, because it's not uncommon where you'll have a patient who comes in with a melanoma, and guess who found it? It's usually their loved one that was looking out for them. So if you notice anything changing that's new or stands out, you should come in right away, or have it seen through like a telehealth visit, which Dr. Brouha will elaborate on at the later part of this presentation. I think that just looking at your own skin is important. And you don't have to be an expert. I don't expect you to be a dermatologist at home. Just try and look for things that stand out that are obvious. Something that Dr. Brouha coined the term something that your dog would bark at. So it's something obvious. You don't need to know that the little upper right quadrant of the mole looks slightly irregular. Just something big. Doubling in size over the course of a couple of weeks. Something that anyone can notice, which is change. Next slide. So another common question that I get is, what should I do to help lessen my chance of getting melanoma? So this is a really good question, and the obvious answer, or obvious first answer, is going to be sunscreen, sunscreen, sunscreen. And I really am an advocate of making sunscreen a daily habit. Some patients will only use it only if they're going out to the beach for extended period of time. But I think that you should just put it on your in your medicine cabinet or on your bathroom sink. So every time you get ready in the morning, you can just put it on before you go to work. UV radiation can still damage skin even in the winter on cloudy days. So just because it's cloudy outside doesn't mean you shouldn't wear sunscreen. I definitely suggest using a broad spectrum sunscreen, which means that it protects against both UVA and UVBs, and aim for an SPF of at least 30. Another big thing of helping you reduce your chance of getting a melanoma is sun protective clothing. I personally am a big fan of sun protective clothing. I have a couple pair of UPF shirts, some hats, and pants, and they're great because it protects your skin from the damaging UV rays without having to glob yourself all over with sunscreen, and it makes it a lot easier, as a person to do, because it takes 2 seconds to put on a sun protective shirt rather than 30 seconds, so you're more likely to do it. And you can go on Amazon and get like 3 pairs for 20 bucks, so you're not breaking the bank doing it either. You definitely want to protect your body with some protective clothing and a hat as well. Hats are very important because I see patients all the time with a lot of sun damage on their scalp, just because your scalp takes a huge beating from the sun just because it just sits there and allows all the rays to beat down on it. And you want to get a hat too that is big and floppy and will protect your ears, because I think one of the most common places that patients I personally see forget sunscreen is on their ears. And me personally, every time I go out and surf, I'm globbing up sunscreen on my back, my neck, my ears, inside of my ears, believe it or not, just because your ears stick out a lot and catch a lot of rays that way. And patients don't think about that. So wearing a floppy hat that protects it, or just putting sunscreen on the ears, is important. You also want to time your outdoor activities. And when I say this is you want to avoid UV rays from the sun when they are the strongest. And this is generally between the time of 10 a.m. and 4 p.m. You want to seek shade during the midday when the sun rays are most intense. For me, how I attribute this into my daily life is I like to surf either, dawn patrol in the morning, really early morning, or at night after work, until sunset sessions. If you have an activity that like to do, let's say you like to bike or run, just try and do it in the morning or night. It'll definitely, pay dividends in the future in terms of, keeping your skin healthy and free from melanoma. Another tip of lessening your chance of getting a melanoma is avoiding tanning beds. This is pretty obvious, but tanning beds have been shown to increase the risk of melanoma by up to 75%, which is huge. Melanoma is one of the top 3 cancers diagnosed in young adults from the age of 25 to 29. And scientists attribute this trend to the use of tanning beds among young women. So, I know that, a lot of people like that, dark skin color because they attribute it with, aesthetics and good looks, but tanning beds are not good for your skin, and you definitely want to avoid them at all costs, especially if you're, have fair skin in general, or a family history of melanoma. Next slide, please. What should I expect on my first visit to the dermatologist? This is, a question I get for patients who are a little bit anxious about going to the dermatologist for the first time and, don't really understand what goes on. But before we even we start addressing this question, I just want to say that you should first prepare for the exam. Um, and what I mean by prepare for the exam, I'm basically saying it's a good idea to look over your skin yourself before your appointment, just so you can point out anything that seems odd. You want to check every part of your skin, including your scalp and behind the ears, like I talked about, your back, areas that are even weird, like under your arms, stuff that you normally wouldn't look at, and usually this can be done best with a full-length mirror and a hand mirror to see those hard to reach places. But doing this before the exam will give you a good baseline and be able to point out to the dermatologist spots that you think are concerning, and they can then go ahead and address it. And then when you first arrive at the dermatologist, usually they'll put you in the exam room, and then they'll have you take off your clothes, and you'll be put into a medical gown. The screening usually takes 10 minutes, or can be longer than that if the doctor sees any moles that look unusual. The dermatologist will usually ask if you have any moles that concern you, and hopefully, if you did a good preparation for your exam, you'll have at least a couple of spots that you can point out and then have those examined. The dermatologist will look at every inch of your body. They'll start. I like to start at the top and work my way down. So I'll start at your scalp. Look at your ears, your face, your neck, and just go all the way down to even in between your toes and the soles of your feet. So just expect a really thorough exam. During a skin cancer screening, your doctor is checking for the A, B, C, D, E's of each mole, which are all possible signs of skin cancer. The A, B, C, D, E's are A stands for asymmetry, which is basically means that in the mole, it's not the same shape on both sides. B stands for border, which is border regularity, which is blurred edges or ragged edges. C is color, which is the different shades of tan, brown, or black. D is diameter, which is the lesion has a diameter that's larger than 1/4 an inch. And E stands for evolving, which just means it's changing over time. Another thing to expect is a possible biopsy, which does give some patients anxiety. And usually the traditional biopsy is due to the fact that a visual skin check of your skin only finds moles that are possibly cancer. You can't really tell for sure. The only way to diagnose skin cancer is with a biopsy. If your dermatologist thinks that a mole is a problem, then they'll give you a shot of numbing medication. We use lidocaine with a little bit of epinephrine, and then scrape off the mole and then send it to the lab. And then the pathologist will be able to look under the microscope whether it's contains any cancer cells. There's alternatives to this, which I don't want to steal Dr. Brouha's thunder, but he's going to go into detail the second portion of this about a new uninvasive test called a Dermtech, where you don't need to cut out a mole to determine whether that's bad. But I'll let him discuss that later. Next slide, please. So what are the common sun safety myths? So the first myth is that the hotter it is, the more damaging the rays are. So the heat of the sun doesn't actually, so the heat of the sun doesn't come from its skin damaging UV rays. The UV rays are always strongest when the sun is highest in the sky, but the temperature varies more and tends to be highest slightly later. So if you want to get out and enjoy the nice weather later in the day when it's still warm, the risk of burning won't be as high. Myth number two, I only need to wear sunscreen during the summer when I'm outside for a prolonged period of time. I kind of touched base on this earlier when I was talking about preventing melanoma, but you should really be wearing sunscreen all the time, even if it doesn't feel that warm or if it's a cloudy day. As I said, just put it in your bathroom, so when you get ready in the morning, you'll always put it on, or in the console of your car. And, check the UV index, which can tell you how strong the sun is where you are today. If the UV index is 3 or above, think about protecting your skin, and take extra care if you get sunburnt more easily or have a lighter skin tone. Myth 3, the sun only damages my skin if it causes it to peel. So this is not necessarily true. If your skin's gone red or pink in the sun, that's sunburn, and that's dangerous due to the damage the UV rays cause to the DNA cells inside. But if your skin goes pink and then tan develops, that still counts as having been burnt. But you can't always see the damage. And for people with naturally darker skin, it might just feel irritated, tender, or itchy, but it doesn't necessarily cause your skin to change color. Myth 4, it's okay to get sunburnt every now and then. So generally, in the ideal world, you never want to get sunburnt. Getting sunburnt doesn't mean you will definitely develop skin cancer, but getting sunburnt just once every 2 years can triple the risk of melanoma, which is significant. So if you've had a sunburn in the past, it's a good idea to think about what more you can do to protect your skin next time. Next slide, please. So continuing the common myths that I see a lot, it's myth number 5 is it's a good idea to pre-tan before a holiday. And I actually have patients say this a lot, but some people think that a pre-holiday tan or sunbed tans will protect them from burning, but a tan offers very little protection against the sun. And some studies actually even suggest that pre-tanning only offers a protection equivalent to a factor of 3 sunscreen. So it's very marginal and definitely not where you want to be spending your energy. Just a good sunscreen before the or sunscreen during the holidays is your best bet, especially one that's broad spectrum and SPF 30 or above. Myth 6 is that sunscreen lasts all day. It doesn't. Even if it says once a day on the label, all sunscreen should be reapplied regularly. I know it's a pain and people hate doing it, but it's necessary. Some products will rub, wash, or sweat off more easily than others. But it's also really easy to miss bits of your body, so also don't be shy with it and put plenty on. The best way to use sunscreen is to think of it as the last line of defense for the parts of the body which you can't cover up with clothes. Myth 7 is you can't get sun damage through glass. So indoors, you're mostly protected from the sun, but UV rays can get through glass. So if you spend a lot of time driving when the sun is strong, then long term you might be at risk of damage from the UVA rays. And it's really funny because I see this in clinic a lot. When you have patients come in who are truck drivers where their left side of their face is just totally beat up, full of skin cancer, and the right side of their face is okay. And it's actually reverses in countries where the driving is on the opposite side of the road. So most people just don't feel the heat or the burning from the sun coming through the glass of the car driving. So they don't think that it's causing any damage, but the UVA rays are still getting through and causing damage. So if you're driving a lot, or even if you're just like a 15-minute commute, you should still be putting sunscreen on your face. Myth number 8 is double the SPF means double the protection. So I'll start off by just saying that no sunscreen is 100% effective, but going higher than SPF 15 might not offer the protection boost you'd expect. Researchers have found that as SPF increases, the additional UV that sunscreen can absorb tails off, offering less and less added protection. So you kind of get a diminishing returns. So it just doesn't mean that 30 SPF sunscreen is twice as good as SPF 15. It kind of diminishes a bit. But those are the all 8 myths that I'd say are the most common. And then I'll kind of let Dr. Brouha transition into the second portion of this, and he'll kind of go over to you like basically addressing the anxiety issue of going in person to see a dermatologist during the time of COVID-19, and ways that you can do telehealth and tests at home.
Thanks, Evan. I will get things ready for you in just a second. I'm just pulling it up. All right. That should get me in there and on to presentation mode. Okay, so today I'm going to talk to you about non-invasive and remote testing of pigmented lesions, which has gotten to be very important in this new world we live in, where we were trying to minimize our personal interactions. So here is to minimize unneeded exposure. And after seeing too many high-risk COVID candidates with low-risk moles, I needed a safer way to screen pigmented lesions. So Dermtech, interestingly enough, is a molecular biology company that has a test that they could use, that I used to use in the office a lot, where I would put a piece of tape on a mole and get back a result that would allow me to know whether or not the mole was a dangerous mole. And we figured that we might be able to do this at home. And so Dermtech started sending this test directly to patients. And so I can get the screening test in place before the patient needs to come in. And interestingly enough, in about 90% of cases, the screening test is negative. So the patient come in to get a particular mole check. In the 10% of the cases where the Dermtech is positive, their melanomas, 7 to 93% of the time, when a biopsy is done. And that depends on which particular Dermtech positivity readout is in place. So there's a single positive, which is 7%, a single positive, which is 50%, and there's a double positive, which is ready 93%. And so when you biopsy these moles, about 93% of the time, they're actually melanoma. So these, in my mind, are worth a risk of a face-to-face visit, because catching melanoma early, as Evan stated, is super important. So I took a closer look at my pigmented lesion workflow. And in my mind, some of these are obviously melanomas, and these I just biopsy. Other ones are benign nevi, and these people I just reassure. But a lot of them are, well, what I call tweeners. These lesions are somewhere in the middle, and I'm not really sure whether or not they're melanoma. They may have a few characteristics of a melanoma, but I'm not really sure I want to bring the patient in if he's 90 years old. So I would say, let's keep an eye on this one in the past. I would say maybe take another 3 months and take another look at this thing. Let's come back and remeasure this one. Or finally, when we were able to photograph things more easily, let's photograph this one and take another look. But then I'd go home after a day of doing that, and I would lose sleep over this. So I decided I don't want to do this anymore. I'm going to All of my tweeners I'm going to test from now on. And so I Dermtech all of my tweeners. And the tape test works like this. You got a concerning pigmented lesion that you or the patient sometimes prefers not to biopsy, maybe because of a COVID exposure risk, for example. And you can have Dermtech send the kit directly to the patient. And then you get the patient on a teledermatology appointment and walk them through the collection of samples to make sure it all goes correctly. And then they send the kit directly back to Dermtech. Dermtech does some analysis that involves the extraction of RNA and some molecular biology magic. And they have an algorithm that basically answers the question, do I really need to risk a face-to-face visit to biopsy this mole? And 9 times out of 10, the answer is actually no. So my thoughts on COVID, this is a really nice way of dealing with these at-home lesions, which are rarely very dangerous, but when they are very dangerous, you definitely don't want to miss them. So we test the telederm lesions. The PLA is a great solution for the telemedicine environment. So how does this work? Well, my workflow goes like this. I don't have 15 years of clinical experience, excluding melanoma via teledermatology. So the situation, I had a mentor who used to say, if you don't know and you can get an answer with a test, do the test. Very simple. Get the answer. So I've now done many of these Dermtech tests remotely, and they're super easy. It does not require a face-to-face interaction, and it excludes melanoma with a very high negative predictive value. It just works. It's very easy. So here's how it works. Day one is the three-way call. I've got me, I've got the patient, David in this case, and I got my MA. And Jane and I are doing a three-way FaceTime with my 1015 telederm patient, David. And David says, Doc, I've had the spot for a few years, but I think it might be changing. Let me show you. Bang. There's the picture that he sent in ahead of time. I look at that thing. I go, ugh, it doesn't look that bad, but I'm going to be wrong in at least one of these in my career. This is a tele tweener. So I can't tell you for sure that the spot isn't a melanoma. I bet it's benign, but one of the next 50 of these is going to be a melanoma, and I don't want to miss it if it's yours. And David always says, yep, that's why I'm here. So at this point, I get off the phone and Jane arranges a Dermtech remote testing of the spot. I go on to my next appointment with Tanner and my other MA, and we talk about acne. Jane, meanwhile, is on the phone with David, and she uses her electronic medical record to take a picture of her FaceTime image of David's spot on her phone. Kind of tricky, but it allows us to know exactly which spot is the right spot. She then makes a follow-up telederm appointment with David to walk him through collecting the Dermtech sample in about 3 days. So now she's all by herself, and she uses the computer to produce a PDF which has David's key information, his address, his insurance, the site of each test that we want to do, and my name and my office information. So she sends this key information to Dermtech, and we use the Dermtech physician's portal to upload it, but you can just call Dermtech if you like. Once Dermtech gets the key information, they mail David a testing kit, and they get on the phone with him and they say, hey, do you want to drop this thing off at FedEx when you're done, or do you want UPS to pick it up from your doorstep? And you'd be surprised. Patients are very polar about this. Some really don't want to go out of their houses, and others don't want people to come to their front doors. So day 4th now, Jane and David are on the phone. Jane contacts David with FaceTime and walks him through the included instructions. They're very clear here. I would recommend if you're going to do this, to sort of review this before the phone call. But most of my patients tell me, you know what, I look through these things, I think I can do it on my own. I want to make sure that they do it right, so we just have Jane watch, but otherwise it generally goes without any hitch at all. And there's an extra sample kit in each package just in case if something goes sideways, you can get it back on track. So fast forward to day 6 now. I get a Dermtech report in my office. In this case, David's lucky. Neither link the gene nor PRAME the gene is detected. So this is a low risk situation. And so we get to call David and say, hey, your tape test is negative. Your mole's very low risk. Let's take another look in 6 to 12 months. We already have a picture of it on our EMR. We can compare at that point. If it's not changing, you're probably just fine. So we've just excluded melanoma remotely in about a week. No contacts, no COVID concerns, done. So my thoughts here are, no biopsies, avoid lawsuit, unneeded face-to-face visits. It's a great way of doing things. In this same group of cleaners, Dermtech caught 14 melanomas. I'm pretty sure Dermtech has saved some lives in my practice. So I was bringing all my patients with pigmented lesions into melanoma. And when you got a 93-year-old guy, it's probably not in his best interest to expose him unless you've got a good reason. So most of these things ended up being benign. Remote Dermtech can exclude melanoma without risking the face-to-face, which is great. As my mentor used to always say, it's never a bad idea to test. So with my closing screen, thank you. I'll open things up for discussion at this point, and a little bit of information on here for you. This is our office number. We can do telederms anywhere in the country if you want to do that. And then some additional information about Dermtech, you can email pla@dermtech.com. PLA is pigmented lesion assay. Or here's a phone number for you if you want to call and talk with anybody. And now we'll go on to questions. I'm going to open back up.
Hi there. Yes. Having any previous history of non-melanoma skin cancer, which includes basal cell or squamous cell, does increase your risk of having a melanoma. So that just makes it especially more important if you do have any type of history of skin cancer to always be going in for regular skin checks. To always stay on top of doing your monthly at-home self skin checks too. Just making sure nothing new or dangerous is popping up. All right.
Now,
Well, I just want to say thank you
could
guys
you
so
hear me,
much
Evan?
for. I'm sorry.
Could you hear me?
You were a little muffled at some points in and out. It sounded like maybe your hand or something was over it, but I think at like the last slide or two, it got a little bit more muffled.
Okay. Ugh. I don't know exactly what happened with that. I apologize for that. If there's any questions that I can answer because of that, I'm happy to do it.
All right. Well, it doesn't look like there's any more questions. So I'd just like to thank everyone who tuned in to watch this presentation, and stay safe out there.
All righty.